Hi, I'm Joe Ruffalo, the President and Chief Executive Officer of Niagara Falls Memorial. And what I'd like to share with you today is the process in which we will be starting up our elective surgical program. So last week we received guidance from the governor's office that hospitals in Niagara County are able to start up elective outpatient surgery. We have been planning on the commencement of our outpatient surgical program for several weeks now. And as a result, we have put in place additional precautionary measures in addition to the pre-op clearance that a patient would have to go through for getting outpatient surgery scheduled. So the program will begin on April 28th, Tuesday. And in addition to pre-op clearance, what we are requiring is for every patient to also have a COVID test 4 days prior to surgery. The reason for that is we're concerned about primarily the asymptomatic patient, the patient that doesn't have any signs or symptoms of the COVID virus, but may be positive. So science tells us from the day that an individual contracts with the virus, and 4 days later, it's the incubation period that takes 4 to 5 days. So with the taking of the test, we will know within 24 to 36 hours if an individual tests positive or negative, and we will notify your respective physician. So that will determine the red light, green light for the day of surgery. And then, of course, the day of surgery, when you come in, you will also be screened for COVID symptoms as well. What we have set up at the Sholkoff Nursing Facility is a drive-through for patients that will be scheduled for procedures. And this is Pine Avenue. This is Pine Avenue here. So you'll be coming in towards the nursing home in the circle. You will drive through. You will stay in your car. You will be asked to show your identification, lower your window, and we will have a clinician come out and do a swab test, and then you will drive away. It'll be a very simple process. Again, though, we are requiring that not only for elective surgical procedures, but also for GI procedures, for colonoscopies, endoscopies, for interventional radiology procedures, and also for elective cardiac cath procedures. There'll be more instructions in terms of when you receive a phone call, listing out exactly what you will need to do. The types of surgeries that we will start off will be minimally invasive general surgery that will be performed either laparoscopically or robotically. Again, these are primarily outpatient procedures. Gynecology, urology, arthroscopic orthopedic work for shoulders, knees, neurospine, and as I mentioned, GI procedures as well. So that is the first phase of our surgical program. Now we will be watching our COVID inpatient activity at the same time, because what we need to make sure is that we don't have a surge of COVID patients coming in that start tying up more and more inpatient beds. If that were to occur and we exceed a threshold that was set by the state, we would have to cease outpatient surgery until such time that the COVID inpatient beds became more stabilized. So think of it as a water valve where we're going to be monitoring our COVID activity and our outpatient surgery activity to make sure that we have sufficient bed capacity to handle both issues. The last thing I want to leave you with is don't delay treatment. We are seeing cases that come into the emergency room that become somewhat disastrous because they're waiting waiting for treatment. For those of you that have primary care physicians, with Niagara Falls Memorial, call your doctors for an appointment. We do telehealth now at all of our primary care centers. Very convenient way for you to interact with your primary care physician with respect to a particular issue or a chronic condition that you have. Chronic issues, acute issues, chest pain, stroke symptomatic, those kinds of issues that are somewhat urgent, emergent, come to the emergency room. It's safe. Trust me, it's very safe. Don't hesitate for delay in treatment because the risk to you becomes much greater when you finally present. The last thing is with respect to testing, there isn't a day that goes by that I am not asked if Niagara Falls will have testing sites for the general population. Because the testing that we're going to do right now through the drive-through, again, are only for scheduled patients for surgery or for the gastro unit. We are planning to have several sites that we will open up and staff for testing for the main population. But keep in mind, you don't want to get tested for the sake of just getting tested to find out if you're positive or negative. Because if that was the case, you would have to get tested every single day because you could be negative today, but you could be tested again tomorrow and all of a sudden you could become positive. So it makes absolutely no sense for someone to get tested every single day, right? What we are encouraging is those that have signs or symptoms of the COVID virus, or those that have been in direct contact with somebody that is tested positive. Those are the individuals that we would encourage to come for testing. We will be announcing shortly probably several sites throughout Niagara County where we will set up test sites for this. Thank you. Stay healthy. Stay connected with us.